Hi everyone. Today in this video let us discuss the side effects of Naltrexone. Naltrexone is one of the medication which can be used to treat alcoholism. Chronic alcoholism can be treated by Naltrexone as this drug can reduce the craving for alcohol. For chronic alcoholism, Naltrexone can be used in the people who are ready to stop alcohol intake. Similarly, this drug can also be used for the treatment of opioid dependence. Opioids are one of the important centrally acting analgesics, but most of the opioids are addictive in nature, and because of this addiction, they can induce dependence in the people. This dependence may be of two types, either physical dependence or psychological dependence. Physical dependence results in withdrawal symptoms, whereas psychological dependence results in the craving for the drug. Now, Naltrexone can reduce this opioid dependence because it is one of the opioid antagonists. So, this medication can reduce the dependence with both alcohol as well as opioids. But while using Naltrexone, we can observe few of the side effects. Fortunately, Naltrexone produces mild side effects and they are well tolerated. But still, we can find few of the important side effects of Naltrexone, which should be thoroughly controlled for a successful treatment of opioid dependence and alcoholism. So today in this video we are going to discuss the important side effects of Naltrexone and how they are managed. So let's go one by one. The first one is the gastrointestinal side effects. Since Naltrexone reduces the intake, it can affect gastrointestinal system. In most of the people we can observe nausea and vomiting as important side effect. And even this medication can produce abdominal cramps and abdominal pain. But here, nausea and vomiting is the important side effect of Naltrexone, which may result in the withdrawal of Naltrexone due to severe nausea and vomiting. So in such people, caution should be taken in order to minimize the nausea and vomiting. That's why Naltrexone should not be taken on empty stomach, because empty stomach always induces the nausea and vomiting, and since Naltrexone is a opioid antagonist, it can act like a bitter and toxic agent, so it can induce the reflex mechanisms resulting in nausea and vomiting. That's why Naltrexone should not be taken on empty stomach. Second important consideration is that Naltrexone should be taken along with carbohydrates. So food rich in carbohydrates can reduce the induction of nausea and vomiting. For example, bread is a rich source of carbohydrates, so when this Naltrexone is taken along with the bread, the severity of nausea and vomiting can be reduced. But in few of the people, we can observe some significant nausea and vomiting, and if it is required, Naltrexone can be taken along with simethicone. Simethicone is one of the ulcer healing agent, and it also acts as anti-foaming agent. Since foam can increase the reflex mechanism and induce the nausea and vomiting, simethicone can be given, which can reduce the foaming formation as well as any reflex of gastric components. So in few of the people, Naltrexone can be combined with simethicone syrup in order to reduce the nausea and vomiting. So by taking these precautions, we can minimize the gastrointestinal side effects of Naltrexone. Second important side effect are the central side effects. Since Naltrexone acts on the brain and it can reduce the central activity, it can produce few of the side effects like dizziness, sleepiness, sedation, and some headache can be produced by Naltrexone. Here we can clearly observe that opioids are sedative in nature and Naltrexone is an opioid antagonist, but still it can produce sedation as one of the important side effects. This indicates that Naltrexone can reduce the opioid activity, but at the same time it can depress the CNS to produce sedation and sleepiness. So with the early days of treatment with Naltrexone, we can observe some sleepiness and drowsiness in the people. So while driving the vehicles or working with machinery, caution should be taken because Naltrexone can impair attention in the people. But at the same time, Naltrexone is not inducing the sleep completely, so it only induces some sedation and drowsiness in the people. Apart from these side effects, it can also produce syncope, some imbalance in the body, resulting in falling. Even it can produce some fatigue, weakness in the people, insomnia. This is more important because Naltrexone can cause lack of sleep, disturbance in the sleep, even it is producing sleepiness and drowsiness in the people. So at the daytime, the people may have some sleepiness and drowsiness, But during the sleep hours, they may have some disturbance in the sleep. So insomnia is another important side effect of naltrexone. And even it can increase the hallucinations. Some psychological behavior can be produced by naltrexone. But all these side effects are well tolerated, they are mild, and they may disappear with continuous use of naltrexone. Third one is the depressive symptoms. Since naltrexone is used for, it can affect the mood, so it can produce some mood swings in the people. As naltrexone interferes with the reward system in our body, the changes in the mood may be observed with naltrexone, which may impact thinking behavior. So with use of naltrexone, in few of the people, we can observe suicidal initiation. This is particularly more important in the young and adolescent people, where the suicidal risk is more pronounced with use of naltrexone. Fourth one, anxiety symptoms. One of the purpose of naltrexone is to reduce the craving for opioids as well as alcohol. So it can reduce this craving, thereby it can reduce the dependence. That's why naltrexone can be given in the people who are intended to stop intake of opioids and alcohol. In such people, craving for the medication and alcohol is reduced by naltrexone. But at the same time, this medication can increase few of the anxiety symptoms with unknown reason. So with use of naltrexone, we can observe some nervousness, agitation, palpitations, increase in the heartbeat, where you can feel excessive heartbeats, and tremor can be produced by this medication. Not only these anxiety symptoms, naltrexone can also produce other symptoms like insomnia, just we have discussed. It can produce some disturbance in the sleep, which may be related with anxiety. And even it can produce a state of confusion, some irritability, which may be commonly observed in many of the people when they are not having alcohol or opioid intake. And even this medication can also increase the worry in the people. All these are the anxiety symptoms that may be observed either due to the use of naltrexone or due to lack of opioid or alcohol. So these symptoms are initially observed, but later on treatment with naltrexone, all these side effects may disappear slowly. Fifth one, effect on appetite. Naltrexone is one of the medication which can produce some loss of appetite. That's why this drug can be combined with bupropion, which is one of the antidepressant drug, and this combination can be used for the management of weight loss in the people with obesity. This is one of the FDA approved indication for the treatment of overweight. Naltrexone and bupropion can control the appetite by acting on few of the pathways like POMC, pre-opiomelanocortin. So this is one of the clinical indication of this combination. But when this naltrexone is used for opioid dependence, it can produce loss of appetite. So people may have less food intake, and they can also observe some weight loss on long-term treatment with naltrexone. Sixth one, effect on secretions. Even naltrexone is not directly related with any exocrine secretions, but it can produce few of the side effects that are associated with either increased or decreased secretions. First one, it can produce some increased thirst, which may be associated with decreased secretion of salivary glands. So a state of dry mouth can be observed with increased thirst, and this drug can also increase the sweating, which may be due to excessive heat produced in the body. It can also increase the tears, lacrimal secretion. Finally, it can produce some toothache, which is commonly observed in many of the people. The proper reason is unknown. All these side effects can be observed with use of naltrexone. Seventh one, effect on muscle and bones. Another effect of naltrexone is observed on the muscles as well as the bones. It can produce some muscle pain as well as joint pain. Since opioids act as analgesics, they can reduce the pain, but naltrexone is a opioid antagonist, so it may increase nociception, resulting in muscle pain and joint pains. Eighth one, other side effects. With use of naltrexone, we can also observe some cold-like symptoms and difficulty in breathing. These are the various side effects of naltrexone that are commonly observed in many of the people, but all these side effects are very mild and well tolerated. They may not interfere with the treatment of naltrexone. In most of the people, nausea and vomiting is observed, which can be minimized By intake of naltrexone along with carbohydrates, and central side effects like dizziness, sedation, sleepiness, and insomnia are important side effects that can be produced by naltrexone. So that's all about the side effects of naltrexone. Hope this video is useful to you. If you really like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.